Hello and welcome back. I'm Kirti from Kirti Institute, and in this video, I'm going to give you some strategies that you will need to apply on OET Listening Part A. I'll also give you some general instructions that will be useful to you. So let's talk about it. OET Listening Part A has two workplace consultation extracts. In each extract, you will have 12 gaps, and you will be asked to identify the specific information from the recording. There are total 42 questions in listening, and 24 questions are allocated to OET Listening Part A. That means it weighs for more than 50%. Hence, it must be your scoring part, isn't it? How to approach OET Listening Part A? You will have context statement. You have to read that context statement to identify the speakers. Then you will be given 30 seconds to read and predict your answers. You will have to write your answers on the given blanks as you listen. So let's learn about how to predict the answers. Here on the screen, you can see there are 12 blanks in first extract. And this is your context statement that will help you to identify about the speaker. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or a short phrase that you hear. You now have 30 seconds to look at the notes. This will be spoken into the recording. You need to understand that there are two people, it is a dialogue, and it is between a physiotherapist and a patient. There will be generally a specialist, not a general physician. So identify what is the specialty, and accordingly, you can predict the answers. Let's see here. Patient Ray Sands, 18 months ago, back injury sustained, lifting dash. What you need to do, you need to underline the keywords before and after the blanks. You also need to go through these subheadings that will help you to understand the structure of interview. If you are a good reader and if you can read everything in this extract within 30 seconds, it's well and good. But if you can't, you have to read the sentences that has blanks. So here, 18 months ago, back injury sustained, lifting what? It is asking about something. And so it will be a noun. And as you are aware, the noun comes with adjective and possibly article. So the answer can be a heavy suitcase. So think about the article, the adjective, and a noun. All right, let's move. 1 year ago, 6 months ago, last month, patient's description of symptoms. This is your keyword that will help you to get into the second blank. Pain located in. So here in is asking about the site of the pain. Here it is clearly mentioned located. So this is asking about the location of pain, right? It is inside something. Pain described as. So the preposition as is talking about the type of pain, right? What kind of pain it is. Number 4 mentions inability to dash as most frustrating aspect. So inability to what? Can you guess? Inability to walk, to stand, to bend, as it is back injury, to bend. Okay, so this blank is asking about the action verb. After to can be action verb. All right. Next is best sensation. So this is asking about what kind of sensation it is. Okay, like tingling sensation or some other type of sensation, but something with ing, right? Let's go to occupation. Occupation, they will not speak exactly as it is given. They can use paraphrasing statements like job description or job or work, something like that. Dash involves travel or some manual work. So you need to predict what kind of job involves traveling and manual work. Okay, so you can predict about a travel manager or travel agent, something like that. All right. Initial treatment, prescribed NSAIDs, application of something, provided some relief. So application of what? Okay, application of an ointment. It can be a name of a drug or it can be a group of medication. All right. So you need to think about the naming word, right? So again, noun. Reference dash briefly. So here also it is about the reference. So we are predicting about noun, right? Some common noun. Sports injury specialist. So similarly here also some referral must be there. Further treatment, epidural injections dash electrical impulses, decided not to try something. Patient attributes recovery to what? So here you can predict some other treatment related to back injury or decided not to try something. Now here you can come in the trap. Like initially the recording or the patient may say that I applied hot fermentation. Okay, it was very effective. It significantly helped me to reduce my pain and I was happy with the treatment. But later on, because of some pain or burning sensation, I decided not to try. So my answer of hot fermentation came quite early, okay, and not to try came later on. So you need to listen very carefully with full on concentration for each and every word spoken into the audio. All right. So be careful about this kind of traps. Now, what kind of word can be suitable here? Like not to try something, some treatment. Patient attributes recovery to what? So based on patient's perspective, the recovery is associated with what? As a result of what? Okay. So here the meaning of to is as a result of. Okay. According to the patient, recovery is because of what? Next, previous diagnosis, sciatica, probably related to dash. So here the meaning of to is associated with. Okay, sciatica associated with what? So here you can see in blank 4, inability to do something. So you can predict about the action verb. Here, the patient attributes recovery to dash. So recovery because of what? And here related to dash. So what is the association between sciatica and the answer? Okay, so you need to predict your answers like this. Let's see for the extract 2. Let's read the context statement. You hear a consultant dermatologist talking to a patient called Jack Wenner. For questions 13 to 24, complete the notes with a word or a short phrase that you hear. You now have 30 seconds. So right now, I'm teaching you how to predict your answers, how to increase your prediction skills, okay? But once you finish predicting for first 12 gaps, within 30 seconds, the audio will be played for this extract and you will have to write your answers simultaneously into the given blanks. Then the extract 2 will be started. You need to read the context statement and then within 30 seconds, you will need to prepare for next 12 blanks. I hope it's clear. Let's start predicting again. On the dash of his left hand. So on the says about the surface, okay, but already given left hand. So this is asking about the part of the left hand, okay, on the elbow, on the fingers, on the palm, on the shoulder, where exactly it is. Again, asking for the location. Preceded by something, aggravated by what? Okay, as a result of what? Then dash formed and joined up. Something formed, okay, it is a formulation of something. So this is asking about the noun. GP describes appearance of lesion as dash. So as again asks about the type of lesion. All right. History of condition also had a lesion on his dash. On his again where exactly? Asking about the location. Okay, lesion somewhere else. Never recurred there. Not becoming more dash. So this answer can be more susceptible, not becoming more susceptible, more frequent, more often. So you need to think about the about the possible answer. No apparent link to general state of health, dash or stress. So you need to think about the continuation of this list. There is no link between what, okay, general statement of health, what next, and stress. Medical history, dash on lower back in 2016, no sign of recurrence. So this is a medical history, something happened in the past in 2006 on lower back, and you need to identify what happened in 2006. Reports no history of dash. So there must be some medical condition, okay, history, no history of what. Advised that this is, keep in mind that this is a conversation between a dermatologist and a patient. So when you think about the history of something, you can think something associated with the dermatology. Okay. Advised that dash was unlikely to be effective. So some treatment was not that effective. Told him to take care if the skin is dash. So it is asking about if the skin is something, okay, uh, uh, you need to take care of. So skin, what kind of skin can be there that needs to be taken care? So the skin is trapped, okay, or is open, or is broken, something like this. Okay, so you need to predict your answer. Outcome says his quality of life isn't affected. A dash will be arranged. So this is asking about the arrangement. Now, one more thing I would like to say here is that there is an article before the blank. So your answer must start with consonant sound. Okay, something apart from A, E, I, O, Q. All right. So this little tip can also help you to predict the right answer. Now, once you finish predicting within 30 seconds, the audio will be played and you will have chance to write your answers exactly as you listen on the given blanks. I hope you understood how to increase your prediction skills. Now, I would like to move towards some general instructions. This is based on the students' queries that I repeatedly received, and so I decided to make it clear here only. First of all, most of the answers arrive in patient's voice. So be careful when the patient speaks. Okay, but not all. Some answers can be from the doctor's voice as well. So listen carefully, both of their consultation. Gaps always follow the sequence of recording. So your blanks will always be in sequence. Okay, if you're getting answer for first blank, then you should have the answer for the second and then third and then the fourth. Okay, it won't be in a vague manner. Okay, it won't be in a haphazard manner. So it is always in sequence. So take advantage of it. Then if you make any mistake in writing when the recording is played, you can just strike out and write your answer above that your answer which you have striked out. Okay, but it should be into the blank only. If you're writing here and there, it won't be marked. Okay. Spelling error. This is a very common concern. Spelling errors are accepted if it is pronounced same. Okay, that means if you are writing PERACITAMOL, it's fine because I can still read it as paracetamol. However, if you're writing ambulation as amputation, then it will be wrong because both the words have its own meaning. There is also one more thing that you need to keep in mind is about a sound words. Okay, the sounds and those are same, but the meanings are different. For example, wait. Wait for a moment. Okay, so here I'm telling you to wait for a moment. But I lost my weight in 2 months. All right, so I'm talking about my body weight. So both of the words are sound weight, but both has different meanings. So you need to keep in mind that in which context the answer is being asked. So you need to predict accordingly, and you need to give the right answer over here. Yes, one more thing is US and UK, both spellings are accepted. So don't worry about it. Abbreviations and symbols. The universally accepted abbreviations and symbols are accepted, but uncommon symbols and abbreviations are not accepted. Okay, like here in India, we call SOS for if necessary, whereas in most Western countries, I have noticed PRN for if necessary. So these abbreviations will not be accepted. So in my suggestion, as long as you are aware of the full form, do not use abbreviations. Okay. Synonyms are not at all accepted. You need to listen the word and you have to write it down as you listen. So synonymous language is not at all accepted. There is no any negative marking. Okay. So you have to appear for each and every question. If you have missed out any question, just give it a try. Okay. Then no half mark system. If you are giving right answer, you will have 1 full mark. And if you have wrong answer, you will get 0. So provide enough correct information. I mean enough correct information. That means if you have any adjective, article, or adverbs, you have to write it in your answer. And you just have to read it that it is grammatically correct and the word is suitable for the what is being asked, and it is not a paraphrasing in the question itself. Okay, your answer doesn't paraphrase into the given blanks. So just make sure about it. Be aware of the traps. Okay, as I've already mentioned that your answer may come a bit earlier, and then you need to listen everything very, very carefully, especially when you have blanks back to back. It is possible that when you are writing your first blank, the second must have gone. Okay, so when you have back-to-back blanks, while writing, you give equal focus and concentration on listening. Okay, so that you will not miss any of the answer. Then practice, practice, and practice, but practice with the right material, practice with the official material. Okay, so these are some general instructions about OET listening part A. Now, if you have any query about this part, you can write into the comment box below, and I'll be there to help you to make any clarification if required. And if you want to see me again in my next videos, you will need to give thumbs up, okay, and share with your friends, and don't forget to subscribe so that you will be first to get any notifications if I'm uploading something new. If you would like to enroll for online OET training or even offline OET training, you will need to look at the description box below in order to see our contact details. So I'll see you into the next video. Till then, bye-bye.